we have with us Ms. Ishi Khosla, practicing clinical nutritionist, columnist, author, entrepreneur, researcher, and welfare worker. Ms. Khosla is actively involved in clinical practice at the Centre For Dietary Counseling in Delhi, where she deals with a wide range of nutrition-related health problems, including obesity, diabetes, cardiovascular disease, food allergies, digestive and immune system issues, neuropsychiatric and endocrine disorders in adults and children. To scale up her practice and reach out to a global audience, Ms. Khosla has founded a unique score-based nutrition app. Ms. Khosla also has a rich experience and has worked with reputed organizations like AIMS and Escorts Heart Institute and Research Center. She's also initiated the Celiac Society of India, India's first non-profit organization for spreading awareness on celiac disease. She's been awarded many accolades for her work in health and nutrition, with the most recent ones being Women's Achiever Award in the field of nutrition by the Imperial and Cancer Patient AIDS Association and the Jijabai Women Achievers Award. She's also been listed among the top 25 most powerful women in the country by the India Today group. It's a pleasure to have you on the platform today, Ms. Khosla.
Thank you. Thank you for having me, Amini.
So, just to begin with, we would like to understand your background. You have such a rich experience of working in the domains of health and nutrition. So, can you walk us through how you got started in this area?
Well, it's multiple factors, but I think the strongest one was the transformations and the effects I saw of changing one's diet and how one felt and how one dealt with problems. And that happened to me at a very early age when I was probably in school.
Right.
And it drew me to reading and researching this area just as a hobby. And then, at that time, I didn't think I'm going to make it a profession, but literally the way my body changed by changing caloric intake, the way my skin changed, my energy levels, and a whole lot of things which were really not something which one would normally expect at that age. And then the research into vitamins and calories and foods and the impact of fats, etc. So it was just, I think, a cumulative effect on my own personality and myself, and which then compelled me to shift from medicine to nutrition as a career choice. And the household, the family also had a huge role to play, because we talked about safe food. There was a lot of conversation on unhealthy food and weight management. These were things which were just routinely. So I kind of absorbed all that, and that became a passion. And ever since, the curiosity has remained, and the interest continues to, it's become bigger and bigger, I would say, with the passage of time. And I would say that it's such a fascinating field, and it's such a deep field that learning is never enough. And we now see a parallel in terms of our understanding of nutrition and food. We have the traditional Indian Ayurvedic system, and the merits of that, and it's a treasure. And what we have been trained in is modern nutrition and modern medicine. And there are huge differences in their approach. And the deeper one delves, the more one finds out, and the need to collaborate, the need to integrate is much more. So it's a fascinating field, and it's growing, and we learn every day, and we've not learned enough, I would say.
Okay. That's wonderful to hear, ma'am, about your journey so far. And I'm drawing on, your years of experience. Tell us a little bit about where you think the nutrition situation in India stands. How has the situation improved over the past few years and decades, and what still remains a pertinent challenge when we look at the entire nutrition landscape in India?
Well, it's a huge, I would say it's a pain point for us to see the kind of interventions and the kind of the government's involvement in nutrition and efforts that have been made with all the ICDS programs and multiples of those kind of initiatives which have happened, iron fortification, yet we have a very dismal performance, and it's not because of, I think, anybody's lack of interest or it's not been a neglected area. It has been given priority, yet our results have not been up to the mark. And the good things that have happened, to answer your question, are, there is much more awareness, there's much more effort from the government. Policies and framework regarding nutrition are very strong, and the breastfeeding initiative, the infant mortality rate, sanitation, and all of these basic, the hygiene, these have improved a lot in the past, I would say. But malnutrition continues to stare us in the face. And malnutrition with respect to, children with stunting and wasting and IUGR, and all of these are still pretty much huge public health issues, along with nutritional deficiencies. And whether it's we talk about protein calorie malnutrition, PM, or we talk about vitamin A, iron, vitamin D has come up as a new one, and iodine, of course, has been addressed. But yes, the impact, if you look at impact nutrition, has not fared that well. And we continue to be having the same number of 50+% women with the reproductive years having anemia, 25% which means 1/4 of our children under 5 years continue to remain stunted. So there, I wouldn't say there is food insecurity. There is a huge, with the Green Revolution, food production has really gone up. Yet these issues are there, and I think today, with the understanding of these problems, deeper understanding at a clinical level, these need to be looked at a little differently.
I think you've highlighted many pertinent points, and I would, like to dissect a few of them. And about, the problem of micronutrient deficiency and hidden hunger, and how pervasive it is, whether you look at an urban diaspora or a rural landscape. So we would like to, get into some of these topics a little bit more. But let's begin by understanding generally, from your experience, what do you think are some, general errors and misconceptions that households have about, healthy diets and nutrition? Because there is so much misinformation, so many myths going around, and especially all that is compounded by the fact that we are in the middle of a pandemic. So what are some important common errors and misconceptions that you have encountered in your work with different individuals, and what impact do they have on how we view healthy diets and nutrition?
Yeah, that's an interesting area, and I find them all the time. But the biggest one I would begin with is about the solutions for obesity. We, in fact, it's not like something which has come up just as a, we have been trained and to believe that calories in and calories out, when that equation is disturbed, is when it results in obesity. Too many calories in and too little out will lead to a positive energy balance, and vice versa. That if you have lower intake and higher output, that leads to underweight. So this is the most flawed, I would say, equation, and perhaps had a relevance at some point in our existence earlier on. But today, it's just not the case. And and even till today, I get patients who come and say, "Oh, doctors have told us to eat 1800 calories or give us 16. So please tell us how many calories our diet has." And I said, that's not relevant. I am going to deal with you without the use of calories. I'm not denouncing the need to, it's a tool, it's a fabulous tool, but I think it's best left for professionals and not for individuals to deal with, because it's not going to work. What those calories are made up of are very important. for instance, if I have a 1200 calorie diet, this is what normally is given to an individual for weight loss. I can just fit in 3 burgers, which can be bought from any fast food joint, and meet my calorie requirement, and be very happy with it, but that won't result in weight loss. So this is one of the most flawed, equations, and the myth around this, that I can burn more and I can all of that. It doesn't work. And I have patients who have been spending over 2.5 hours in their workouts and eating like, literally starving, and not losing and gaining weight. So again, like I said, the point is inflammation, the point is gut health. And most of these people end up eating, when you address these issues in my practice, when I deal with them, and there is elimination of inflammatory components, and we add anti-inflammatory components and address the nutrition, and we replace the micronutrients, we see these people actually eating more than they ever did. So typically these oversimplified connections with health and disease have also led to a problem.
Thank you, ma'am, for sharing that with us, and especially your experience. Now we'd like to, shift gears a little bit. We've spoken so much about households and individuals, but let's now talk about the workplace, which is where we spend almost 1/3 of our day. And it's, workplace nutrition is now emerging as a very important priority for the government's Poshan agenda. So can you tell us a little bit about why we need to pay attention to workplace nutrition, and what, according to you, are some actionable strategies that corporates can implement so that their employees can eat right at work?
Yeah, I mean, this is really an important area, and I was looking up some statistics, and in fact, like I mentioned to you earlier, that my book, Eating at Work, was published in 2019, because
Right.
it was an important part of my practice, because most people got challenged because they were at work and weren't able to follow their diets, and that's what compelled me to look at this issue. And I think 93% of the children, of the individuals in the urban setup are employed, and 1/3 of India is urban India. So that's a huge chunk of people one needs to look at. And the challenges with and the baggage of diseases, in fact, preventive health. If you look at economically, we understand that the cost of absenteeism and low productivity directly impact the economy. And there was a very interesting statistic which I read, that 1 rupee spent on prevention can save 133 rupees in by absenteeism costs, and about 6.5 rupees to the healthcare system. So this is just really a very powerful reason to intervene and at the workplace. And I think that first of all, the onus and the responsibility, first of all, the economics have to be making sense. So the reason why I shared this was because most employers feel that it is an unnecessary cost or a burden to their organizations if they invest in their health, the health of their employees, be it in terms of checkups or in providing healthy food. And I've also, we had a health food company where we also had offices, the counters and the cafes in the corporate offices, and the mindset of an employer is different. They are counting the economy of, or the financial burden of investing in this. And I think first of all, the employer needs to be educated on the importance of this and what it saves him and how it saves his overall costs. So I think this important part of making the employer understand that if he puts in, his heart at the right place, if he invests in the right kind of food and in the health of their employees, will translate into better costs and better outcomes financially. So that's one. And so I think, of course, health checkups, etc., are important. But again, maybe I was reading somewhere 800 million rupees are spent on healthcare, on health checkups. But what happens after these checkups is very important. You just can't make files and kind of just do a very cursory kind of. So if anybody has a problem, they need to be going deeper into addressing those issues, and be it nutritional issues, etc. So having a good nutritional support in the organization, and a medical professional in the organization, and these things are happening. It's not like they're not happening. I'm not saying something which is very unusual, but they're not translating again into improved health and productivity. So they need to be re-looked at and revisited. And of course, availability of healthy food, which is trans fat free food, which is a low sugar food, which is a food without additives and preservatives and processing, is important. And just to give you an example of trans fats, the maximum percentage of trans fat in a person's diet should not be more than 1% in the day, and 2% in the total. So basically, it's important to really look at zero trans fats. That's the goal. And an average Indian who eats in the office setup and has 30 to 40% intake of trans fats, and these trans fats have and they are absolutely pro-inflammatory. We spoke about inflammation earlier. And these are, they have really, we have zero tolerance for trans fats. So that is, so, and why trans fats enter the food chain are simply because they are economically far more viable for a food manufacturer. They are much cheaper, and they also increase the shelf life of the food. So I think these are important corrections which need to be made. And one of the reasons why I got into health foods was not because I wanted to be in business, because I felt so strongly about these issues. So essentially, just going back to the thing that we must use healthy fats, minimize refined oils and processed oils, and go back to traditional forms of eating and simpler unprocessed food. So industrial production of food also needs to be made safer and made healthier. And mass production of food can be done very easily without the use of all of these things, which is what my health food company was all about, that you can make better food without the use of these kind of unnecessary additives. So the workplace does offer a huge potential to provide healthier alternatives to people. And lastly, in terms of education, what is right, what is wrong, correction of eating habits, and maybe just having a healthy competition, report cards on health, on eating. They can also this is also being done where junk food is being taxed, and that is again something which can help. And if you have certain incentives for people to eat, in monetary incentives to people who are performing better, who are healthier, who are fitter, and just not, like a bonus or whatever on performance, but health performance, health quotient can also become one of the drivers for these incentives. So I think that is something which is not difficult to do. It's just an overall investment in time and energy at a workplace. And I would say workplace and schools and education institutions offer huge opportunities to intervene and make the community smarter. And
I think you hit on so many points. And you're right, it's actionable, simple strategies. It's just that the corporate leadership needs to be involved in understanding, how these little changes can be made around the workplace. And at Impact for Nutrition, we do a lot of work around workplace nutrition. We train different corporates through our nutrition learning sessions to sensitize them to the cause and then also help them with simple strategies that they can implement, and is definitely agenda which is top on our priority list.
That's having your heart in the right place.
Right. With that, ma'am, we would like to end our interview today. Thank you so much for taking time out. It's been a truly, truly enriching discussion. So thank you so much for taking time out and sharing your insights with us. And we definitely look forward to having you on the platform again sometime soon.
Thank you so much. Thank you for having me. It was my pleasure.